laser dentistry, like we bought one of the first hard tissue lasers 15 years ago or so, and just the the growth and the technology that we see with lasers, just like our oral scanners, instead of having to take impressions and all that. We went from using what basically was either a surgery like a scalpel, or we went from a scalpel to electrosurge, and now we have a laser. So the laser sterilizes, like for instance, if you have a deep pocket where you have some periodontal issues or gum problems or something like that going on, the laser allows us to go into that deep pocket and sterilize it, and you don't feel any of that. There's nothing uncomfortable. There's no pain involved. You don't have to. 99% of the time, you don't have to have anesthetic. Sometimes we just do topical instead of everybody's favorite needle. So there's a lot of lasers now you can cut hard tissue with, so you can do minimal preparation of teeth, and then the same thing, you don't need anesthetic. You're removing decay if it's minimal. The laser, what I use the laser for too, a lot, like there's CO2, there's an erbium, there's a diode, there's a lot of different wavelengths and they're all meant for different things. Like the one that I use the most, especially with cosmetic dentistry, you'll see somebody with like a gummy smile or something like that, and we know that we need to raise that gum tissue, so we basically contour that gum tissue with a laser, and it's the same thing. You don't get any bleeding, you get instant healing, you don't get swelling, there's really no pain associated with it. Far different than definitely the scalpel, even the electrosurge, because it's almost like you're burning tissue with the electrosurge, where the laser is much kinder, quicker healing. For us, we stay on top of all technology. So my motto, basically, if it's something that is going to benefit our patient, and then we're going to invest in it. If it's something that it's more for us than it is for them, that's not the way that I think. I mean, it's more of, okay, if this is going to benefit, hey, this patient gags, guess what? Now we can do a scanner instead of putting the goo in their mouth and everything else. So that's a win for the patient. The patient's going to heal faster. The laser's going to create that. If we're going to get better results from deep cleanings and we can sterilize the pocket, then again, the patient's going to benefit from that, and they're going to get healthier faster. So, and you think about Star Wars or whatever, that you can cut things and everything. And I think there's definitely fear involved sometimes, and then like, wait a minute, you're going to do a laser, and isn't that going to hurt? And so I would say between the CO2 and the diode, meant for different things, but I feel like the biggest win out of all of that is the patients are prepared for something to hurt, and it doesn't, and then so many times you don't need sutures or stitches and everything else too. So that's the biggest thing is the fear is removed, and what's great is, I mean, it's becoming more commonplace and kind of standard of treatment that, and you would. One of the biggest things is when you have margin in your practice, you're able to purchase equipment that's going to help your patients. Like if you are kind of struggling or you don't have that margin, then you're basically less likely to be able to afford that type of equipment. And so it's a win-win. We get new patients, we get a lot of treatment, and we're able to really invest back in the patient. High-tech stuff that's going to make their visits much easier on them. People being afraid of dentistry, it goes back forever, and obviously, like anything else, the technology has improved, and so for us, it used to be we'd hold a mirror in front of a patient's face, try to show them a tooth in the very back, and we didn't have intraoral cameras. Now we can take a picture, put it up in front of them, and we co-diagnose with them, hey, what's going on? And they can see it and like, oh my gosh, I need to fix that kind of thing. And so just like everything else, every time there's an advancement and there's new technology, and lasers one of the big ones, implants one of the big ones, clear aligners, how are you going to move teeth with a piece of plastic, all of that. So, and along the way, a whole lot less trauma. There's a whole lot less soreness. There's a whole, the healing is quicker, all of those things. So that starts to build a better comfort zone for patients that, brackets and wires are kind of terrible. They chew up the inside of your lip and everything else. And, oh my gosh, you can do this. You don't have to have that. So it's the same thing with the lasers. Oh, I don't need anesthetic for that. Oh my gosh, I don't have to have a shot. Oh yeah, and you don't need sutures because, and that's 90%. Obviously, there's some cases that 10% of the time we're going to have to do anesthetic or we're going to have to do something. But most of the time, after using that technology for years, what teeth are. I'd love to do the laser on you, but this one we need to do something else. And because the last thing you want to do is start working on somebody and then make them uncomfortable, and then all of a sudden there's that fear, again. So, but definitely technology, any of the technology for the most part, like I said before, if it's going to benefit, we're going to have it, and then it's going to make that patient even feel more comfortable. The laser is such an improvement compared to like a lot of the old techniques that we use, especially when you're using kind of a scalpel, or you're using electrosurge, or you're trying to get medication down into a deep pocket where there's gum problems or something. The laser, just healing wise, allows things to heal, and if you get quicker healing, you're going to get better results in the end, less pain, less swelling, all of those things. And so that's a win-win. Using a laser for me is much more specific to what I'm going to be doing. I would say 90% of the time the laser is going to win out on any of the other procedures, especially past procedures. When it comes to, do we still have to pick up the drill and drill sometimes? Do we have to? Absolutely. And it's more of, like you were saying, it's more specific to the patient. And if you have somebody that's high anxiety already, and you've already got them on Ativan or something to relax them, nitrous or whatever, the last thing you want to do is run the risk of, getting them nervous through that. And so there's choices that are made where, okay, look, I'm going to do anesthetic just because I don't want her. Because then all of a sudden, now all the work we've worked toward to get them comfortable and to feeling comfortable and remove that PTSD from the past, we don't want to open that up again. So the laser is going to definitely create so many more benefits 90% of the time.